You are welcome to the International Herbal Medicine Centre, England. The title of this episode is, Dangers of Blood Clots. What everyone should be aware of. A blood clot, medically known as a thrombus, is a gel-like mass of blood that forms when the components of blood, primarily platelets and fibrin, clump together in response to an injury or damage to blood vessels. Blood clots are a critical part of the body's natural response to prevent excessive bleeding when a blood vessel is injured. However, problems can arise when blood clots form inappropriately or do not dissolve properly. Blood clot can be very dangerous if it breaks off from one of the deep veins and moves through the bloodstream into the vessels of the lungs. It has been known to cause death. Please press the subscribe button. Your help is needed to keep this educational channel functioning. Ed. DVT is an abbreviation for deep vein thrombosis. This is a clot that can form deep in the body. These kind of clots most often form in the legs, hips and pelvis. Sometimes they occur in the arms, neck or chest area. It can easily clog up the veins and slow down the blood flow. It is not uncommon to see a victim a rapid change in one of the leg. It is characterized by swelling despite the absence of injury or strain. There are two main types of blood clots. Thrombosis. This is the formation of a blood clot within a blood vessel, which can occur either in veins or arteries. When a clot forms in an artery, it can disrupt blood flow to an organ or tissue, potentially leading to serious conditions like a heart attack or stroke. When it forms in a vein, it is often called a deep vein thrombosis, DVT, which can cause pain, swelling, and, if the clot breaks free and travels to the lungs, a condition known as a pulmonary embolism, PE, which can be life-threatening. Pulmonary embolism is when blood clot is in the lungs. When we get injured, blood clots normally form in the body, to stop bleeding. They go away when the body has healed. Scab is a blood clot on the surface of the skin. Blood clot can also be inside the body to internal bleeding. When a blood clot forms in one of the deep veins in the body, it can block flow, which might cause pain or swelling of an arm or leg depending on where the clot is. Embolism. An embolism occurs when a blood clot, or a fragment of it, breaks off from its original location and travels through the bloodstream to another part of the body. For example, a clot from the leg, DVT, can break free and travel to the lungs, causing a pulmonary embolism. Similarly, clots formed in the heart can break off and cause blockages in the brain, leading to a stroke. Blood clots can form for various reasons, and they often result from a combination of factors. The primary causes and risk factors for blood clots include 1. Injury or trauma. When a blood vessel is injured or damaged, the body's natural response is to form a blood clot to prevent excessive bleeding. This type of clotting is a normal and essential process in wound healing. 2. Prolonged immobilization. Extended periods of immobility, such as being confined to bed rest, sitting for long hours during travel, e.g., long flights, or having a cast on a limb, can increase the risk of blood clots. Immobility can slow blood circulation, making it easier for clots to form. 3. Surgery. Surgical procedures can damage blood vessels, leading to the formation of blood clots. This is especially true for major surgeries or surgeries involving the lower extremities, pelvis, or abdomen. Certain medical conditions such atherosclerosis. This condition involves the buildup of fatty deposits, plaque, in the arteries, increasing the risk of arterial clots. Atrial fibrillation. An irregular heart rhythm can lead to the formation of blood clots in the heart, which can travel to other parts of the body. Cancer and its treatments can elevate the risk of blood clots. Inflammatory conditions. Diseases like vasculitis and lupus can increase inflammation in blood vessels, contributing to clot formation. 5. Hormonal factors. Certain hormonal conditions or therapies can affect blood clot risk, including birth control pills. Some birth control pills can increase the risk of clot formation, particularly in women who smoke or have other risk factors. Hormone replacement therapy, HRT. Estrogen-based hormone replacement therapy can increase clot risk, especially in postmenopausal women. Pregnancy. Pregnancy itself increases the risk of blood clots due to changes in blood flow and clotting factors. 6. Smoking damages blood vessels and promotes clot formation. It also reduces the oxygen carrying capacity of blood, which can contribute to clotting. 7. Obesity. Being overweight or obese is a significant risk factor for blood clots. Obesity can lead to inflammation and changes in blood composition that increase clotting risk. 8. Age. The risk of blood clots generally increases with age. 9. Genetics. Some individuals have a genetic predisposition to clotting disorders, making them more susceptible to blood clots. Certain medications. Some medications, like certain cancer treatments and hormone therapies, can increase clotting risk as a side effect. 10. Dehydration. Insufficient fluid intake can lead to thicker blood, making clot formation more likely. The treatment for blood clots depends on several factors, including the type and location of the clot, the individual's overall health, and the severity of the condition. There are various treatment options for blood clots, and the choice of treatment is typically determined by a healthcare provider. Here are some common treatments for blood clots. Anticoagulant medications, blood thinners. These drugs are often the primary treatment for most blood clots. Heparin. Often used initially in the hospital setting through an IV to quickly thin the blood. Warfarin, Coumadin. An oral anticoagulant that is taken in pill form. It requires regular monitoring with blood tests to adjust the dosage. Others are thrombolytic therapy, vena cava filter, compression stockings, surgery, and lastly, lifestyle changes. Making lifestyle modifications, such as quitting smoking, maintaining a healthy weight, staying physically active, and staying hydrated, can reduce the risk of future blood clots. The choice of treatment and duration will depend on the specific circumstances and the healthcare provider's assessment of the individual's risk factors. It's crucial for individuals with blood clots to follow their healthcare provider's recommendations closely and attend follow-up appointments to monitor their progress and make necessary adjustments to treatment. Please, if you have not subscribed to our channel, please do so. We need your assistance to keep this educational channel functioning.